Today is Arsenicum iodatum, which is a good hay fever remedy. And as I showed a while ago, this is the hay fever, or the asthma and hay fever and all that. Let's see if I can get this normal. All right. So, anyways, you got our Allium cepa, Arsenicum, Carcinosum, Iodata, and Thuja for asthma and allergies. So, as you can see, Arsenicum and Iodatum are in there, but I don't have Arsenicum Iodatum. And then, of course, down when you go to hay fever, that was asthma, allergic asthma. I can't get this there. No, I can't get this paper perfect. But Allium cepa and Arsenicum is there again. No iodatum on the hay fever, but it is good for hay fever. Now, if you use arsenicum, now as you see, nose allergic rhinitis, which is allium cepa and arsenicum, and this is in my community that has all this asthma and hay fever and stuff that you can utilize for free if you have that problem. And the lady down the street, my sister's friend, told her to go get an allergy medicine, and she did. And she says it works great, doesn't have any problems anymore, but she still has it to take it, so it didn't overcome it like my son's eyes swelling shut, but it definitely takes care of her situation. But if arsenicum doesn't work and iodatum doesn't work, and you're considering them, then what would you do? You would go to Arsenicum iodatum, which is this one. That's both of them put together. So I don't know why that's not in there, but this is a great allergy and asthma remedies. Iodide of arsenic. So it's iodide and arsenic put together. Let's see. Arsenicum iodatum is to be preferred for persistently irritating corrosive discharges, any discharges that are like burning. Allium cepa has that too. You think of an onion, you cut it, your eyes burn, water, your nose runs and it burns. But this one here has that any discharges from the anus, the vagina, the nose, the eyes, I don't know about the sweat so much, but those would be they would irritate the mucous membranes. The discharge irritates the membranes from which it flows and over which it flows. The discharge may be fetid, which is smelly, watery, and the mucous membrane is always red, angry, swollen. It itches and burns. So that's, if you have someone who has these allergies and that, and they're having all that burning in that, now arsenicum has a lot of burning in it. So if you try arsenicum, it doesn't work. You went to iodatum, it didn't work. Then you go Arsenicum iodatum. In Arsenicum iodatum, we have a remedy most closely allied to manifestation of tuberculosis. So great tuberculosis remedy, one of them. In the early stages of tuberculosis, even though there is an afternoon rise in temperature, Arsenicum iodatum is very effective in the beginning stages of tuberculosis. It will be indicated by profound prostration, rapid irritable pulse, reoccurring fever, and sweats. So that's in the tubercular stuff. Emaciation, and it can be in your allergies and that. You could have all these symptoms there too, or a flu, or a cold, or bronchitis, or pneumonia. Tendency to diarrhea. So anybody having chronic pneumonia with abscesses in the lung, hectic, debilitating night sweats. So great pneumonia remedy. This remedy is also to be remembered in tuberculosis with hoarse. So the person's hoarse, they have a racking cough and profuse expectoration of purulent nature, and attended with cardiac weakness. So in tuberculosis, or any other stuff, if they have weak heart, all this mucus coming out, a racking cough, they're hoarse. And this, I'd never even thought of this one for my mother. She had that cough. She didn't have sweats in that though. So you really have to match what's going on with that person. And it was tough with my mom because you can't get symptoms out of her. I'm fine. Everything's good. So, anyways, emaciation and general debility. So they're eating an app, but they're getting emaciated. They're debilitated. They have weak heart, a lot of mucus, and it's burning. They have a racking cough. They're hoarse, and it can be in tuberculosis or it can be in a tubercular miasm with a person. In chronic watery diarrhea, in tubercular subjects, in cases of emaciation with good appetite, and that's deep subject, tubercular, and yesterday's was syphilitic and sore miasms. So each remedy corresponds to a lot of these different situations. This remedy can be continued for some time. Clinically, it has been found advisable in tuberculosis to begin with about 4x and gradually go lower to 2x trituration 3 times a day. So that just shows the experimentation that these guys were doing. They probably tried a 3x, they probably tried a 1x, they probably tried a higher 30 C, a 30x, whatever. And then they found that if you give what do they say, a 4x, and then go back it off to a 2x, is that what it was? Yeah, 4x and then back it off to a 2x 3 times a day. In the beginning stages of tuberculosis, you can overcome that tuberculosis with Arsenicum iodatum. Iodide of arsenic. Discharges cause burning. So that's anywhere there's, and that's can be, arsenic has that in it. So you have two remedies. Arsenic has the burning in that. Iodatum has the gland stuff. So they're both together. Thick, gluey, yellow like honey. That's that catarrh. Catarrh is thick, yellow mucus. The other one is thin mucus, which is just thin, watery mucus. And they can have either way. Thin, thick, gluey, yellow like honey. And as you'll see, they'll have a thin mucus dropping down the back of the throat and out the front of the nose. Influenza, any influenza, this is a remedy you definitely consider with a bunch of other ones. Hay fever, that's a 3. Breast is a 3. Uh, all kinds of breast problems, whether it's a tumor or whatever. Epithelioma of the lung and cancers. So the epithelioma is the sheath that covers all the organs in the body and all that stuff. So epithelioma, lung, cancers, these are all 3s. Axillary tumors, which is auxiliary is the armpits. Those tumors under the armpit threaten pyemia, which is blood disorders. So they could have you could see that they're going to have blood disorder problems. It's threatening. Pyrogen, methyl blue, and Arsenicum iodatum would be 3 remedies you consider. Pyrogen is rotten meat, and any kind of septicemia, like I said, that I feel so bad. That old lady, we went up to get vegetables off of her. She says, I can't eat this because she's sick to her stomach from the septicemia she had. And the doctor's cure was to cut off her toe. Now, she's still sick in the stomach from it, where if I would have gave her pyrogen or even Arsenicum iodatum, there's a few of them that I would give for septicemia, So, all right, let's get into the mind. Unable to study causes headache, worse mental exertion, so they can't mentally function is a problem with their mind. Enlarged mesenteric glands. Now you have mesenteric glands in the abdomen. You have 24 glands down there in the abdomen. And these glands, they do everything from, let's see, the glands do everything. Glands. There we go, glands. Oh man, I had that thing up. What do glands do? Oh, here, okay. Endocrine gland, exocrine glands, endocrine glands, and heterocrine glands, whatever that is. Exocrine glands secrete substances into ducts, like your eye ducts, your jaw, your saliva. Endocrine glands secrete hormones. So they send out the hormones for the organs to use. And the hepatocrine glands have both exocrine and endocrine functions. So these are hormones and secretions to lubricate things and all that stuff. So, but you have 24 of them just in the, where the heck am I? 24 bean-shaped glands just in the abdomen. And you've got many more throughout the whole body. Glands are painful, swelling, mesenteric glands, painful swelling right groin, extending leg. So they extend their leg out. They get this pain. They have this painful swelling in the right groin. Burning heat in the back, in lumbar region, as if clothes were on fire. So there's that burning. That's arsenicum has the burning part of it. Chest has burning heat. There's more burning. That's the arsenicum part. Otitis media. That's an infection in the ear with fetus or smelling corrosive discharge. There's that burning discharge again. It's corrosive. Thickening of tympanum. That's the area in the ear that it'll thicken and it'll cause deafness. They have hypertrophy of the eustachian tube and they get deafness from that. So whether it's the thickening or the hardening of the eustachian tubes, not the non-functioning of the eustachian tubes, that's what hypertrophy is. They get deafness from that. So anybody having deafness or having these discharges coming out, you would consider arsenicum iodatum. Scrofulous ophthalmia, that's an eye infection, and scrofulous is tubercular. So tubercular eye infection or inflammation. Burning in the eyes, there's a 3 there. There's more burning. Acrid, which is basically burning coryza from the eyes. Eyeballs feel heavy. Face aching in malar bones. Cancer of lips. So there's a lot of cancer that this is good for. Lumps in breast, worst touch. So any of them anybody having lumps in the breast, arsenicum iodatum would be considered, especially if it's worse from anybody touching it. Or yeah, nipple is retracted. Foul, bloody, yellow, irritating leukorrhea. There's that yellow again, like the yellow coming out of, gluey yellow coming out of the nose and the mouth and that. All them discharges, wherever it is, it's yellow and bloody and foul smelling. Irritating leukorrhea with swelling of labia. So they're swelling up down there in the vagina area. And they got this bloody yellow irritating leukorrhea coming out and emaciation of the breast. The breast starts shrinking. Intense thirst with desire for cold water, which is ejected at once. And I'm pretty sure it's phosphorus that has that also. So they got this thirst. They just want to drink, but every time they drink, they throw up. And that can be in flus, colds, pneumonias, bronchitis, whatever it is going on. Study causes headache. Dull, heavy across forehead and occiput. So the front and the back of the head, you have this dull, heavy aching across it, and it's worse from studying. Pain over root of nose as if she would go silly. I don't know what that means, go silly, but it's driving her nuts. You know, you got this stuffed up feeling in the nose. Weak heart, irritable, pulse is rapid and irritable. So this is good for heart situations. Kidney nothing, pain in humerus, worse writing. That's the arm bone, the upper arm bone, or the upper arm bone. Worse writing. Clothes feel cold. Better walking. So, like I said, when they put the clothes on, it feels cold, and when they start walking, it warms up. Most times, you put your clothes on and it's in a cold room, it feels cold, but this person, it's out of whack. Liver nothing, asthma, lungs, big lung remedy. Asthma, great for asthma, chronic bronchitis, pneumonia that fails to clear up, bronchopneumonia after influenza. So no, they've had pneumonia and it just doesn't go away. They just can't get rid of it. They got chronic bronchitis, always sick, pneumonia, bronchopneumonia after influenza. So they have the flu, and then it goes into bronchitis and pneumonia together. But a lot of lung stuff. They just can't get over the colds and the flus and the bronchitis and all this stuff. It just keeps, it's chronic. It keeps coming up. Never clearing up the pneumonia, chronic bronchitis. After the flu, they get bronchopneumonia. They have asthma. Great lung remedy for Arsenicum iodatum. Pleuritis, which is the sacs in the lungs, they fill up. Pulmonary tuberculosis. Pulmonary is, more of the heart stuff, I would think. Short of breath, air hunger. So they can't catch their breath, and that's like what they call dyspnea. Hacking cough with dry, stopped up nostrils. So they're coughing and they got this pain, like it's in the nose, pain in the nose, root of nose, and that's from this stopped up feeling in the nose. It's dry, stopped up. They got a hacking cough with a little difficult expectoration, which I don't think my mother had that. She was coughing some stuff up. It's yellow, green, and foul. So my mom's was white, she said. I at least got that out of her. Hoarseness. I'm pretty sure gelsemium worked for my mom. That was the first remedy I went for because she was just tired. Anybody that's just laying there tired, you right away shoot for gelsemium. I threw bronchitis or belladonna in there just in case because she had a flushed face. I couldn't tell if her pupils were dilated, but she had a flushed face. She was hoarse. So I threw gelsemium and belladonna in there. And the day after I gave that to her on a Sunday, to Monday, she finally got up and was eating. She didn't eat Sunday. She wasn't out of bed Sunday. And we come down and visit her every Sunday, and she didn't come down. She spent a little bit of time, but she didn't eat nothing, went back to bed. So hoarseness, aphonia, no voice. That's what aphonia is. So hoarseness. She had all that hoarseness. She had a cough. The mucus was yet white, so this wouldn't have been a medicine for that. But anybody gotten yellow, green, foul, mucus coming out of the nose, the vagina, the lungs, and if there's tuberculosis there, you'd have blood in the mucus too. All right, so no male, no mouth. Hay fever. So here's the nose stuff. So this is why I say it's good for the upper respiratory, this medicine. Hay fever. Coryza with dyspnea, can't catch their breath. A lot of thick mucus, that thick yellow honey-like mucus with can't catch their breath, dyspnea. Thin, watery, now this is the other end of it. Thin, watery, excoriating, which is burning, like, messing up the mucus membranes. Excoriating discharge from anterior, the front of the nose, and posterior sinuses. So it's dripping down the back of the nose. It's also coming out of the front of the nose. This is all a 3. Thin, watery, excoriating, burning discharge from anterior and posterior sinuses. Persistent, unsatisfactory sneezing. So they've constantly got this sneezing going on. I think it was Allium cepa also had that. Let me see this thing here. Yeah, so I put down Allium cepa has that big sneezing thing. And Arsenicum has the shortness of breath. So that's why Arsenicum's in this one. Chronic nasal catarrh. Catarrh is the thick yellow honey. So this is chronic. They always have it. Whether a cold or not a cold, they always have this catarrh. That's a 3. Membrane is sore and excoriating. So any mucous membranes are very sore, angry looking, it says, and excoriating. They drip water out of their nose, which is hot, green, acrid, reddens upper lip. So burning the upper lip, and it's very hot, acrid, and green. Influenza, very good for influenza. Diarrhea with dysentery. Stools are scalding white. So that's interesting. So I always ask, what color is your stool? If it's green, I think of gelsemium, belladonna, a few other ones. White now, I think of Arsenicum, Iodatum. Now, perspiration. That's a big one because they have debilitating night sweat. So at night, they're always sweating. And it's debilitating because they're probably not getting any rest because of it. Dry, scaly, itching psoriasis. So you see them commercials on there for psoriasis and eczema and all that. Well, this medicine would clear it up without any side effects. Marked exfoliation. Exfoliation is the peeling of the skin. in large scales, leaving the surface burnt-like, excoriated. Enlarged scrofulous or tuberculous glands, like a goiter or any other glands that would swell up. Scrofulous is tubercular. Tubercular miasm and all that bring up, swelling of the glands. That's a 3. Ichthyosis, ichthyosis, which is just same thing, dry, scaly, itchy skin. Venereal bobo, a sore on the penis or the vagina from venereal disease. Eczema in the beard. Okay, pain and heart. Pain and heartburn. They vomit 1 hour after food. So they eat, they get this heartburn, they get this pain in their stomach, and they vomit that food up an hour later. Uncomfortable nausea. Intense thirst, and water is immediately vomited. Temperature, drenching night sweats. That's a 3. Emaciation. Even though they're eating well, they're emaciated. Pulse is reoccurring fever and sweats. So they just always have this fever and sweats in a bronchopneumonia, pneumonia, influenza, bronchitis, all this stuff. They would have these reoccurring fever and sweats. They're chilly, but cold aggravates that chilliness. So any kind of coldness, they really get chilly. And that's probably the fever to chill, the fever to chill. Pulse is irregular, rapid, feeble, and weak. So their pulse isn't doing good. So that's why a lot of times you take the pulse, and that tells you where that patient's or that person's at. Raw, burning tonsils, and they're swollen. So there's that swelling tonsils there. Anyways, diphtheria. Diphtheria is a waterborne illness, basically. Goiter. They have a goiter. Chronic follicular pharyngitis with burning. So they got this burning, chronic stuff going on. They've got swollen glands. They got goiter going on, possibly. The tonsils are swollen, raw and burning in the throat. And vertigo with tremulous. They tremble, especially in the elderly. So elderly patients that have trembling going on, and they have vertigo with that, you would consider Arsenicum iodatum. Let's see. There's no reading on this one. So, like I say, tomorrow's going to be Arsenicum metallicum, which there's not much to that one either. So anyways, let's go into here. Let's go into comparing them. Tuberculinum, calibrionium, and antimonium tart. These are 3 remedies that you would be considering along with this. Calibic has that thick yellow mucus. Tuberculinum has swelling of glands and blood in their, they can have a chronic cough, all that kind of, stuff. Antimonium iodatum. So these all are in hay fever. Hay fever you would consider, these 3 you would consider with this one. Aurelia, naphthalum, whatever that is, rosa sanguina, okay. Bacillinum in acrid discharges. Nitric acid, ale, arsenicum metallicum, and its salts. So you would consider that in acrid discharges. Bacillinum, nitric acid, aurum metallicum, arsenicum metallicum. So those ones you would all consider with acrid discharges. It's useful after sulfur. So you're giving sulfur to a patient, and they're getting better. Then you'd give Arsenicum iodatum in tuberculosis pulmonalis, and after conium is sensitive to lump in breast. Oh, conium. I don't know why there's not a comma there, but after sulfur, you give sulfur in tuberculosis, you give Arsenicum iodatum afterwards to finish out the case. Conium is sensitive lump in breast. So iodatum, Arsenicum iodatum has that lump in breast, but conium is a big one for lump in breast, and especially cancer in breast. It antidotes bryonium, relieves pain and heartburn. Complementary to Kali iodatum and phosphorus. So that's pretty much it for this. Okay, let me do this here real quick because this is important stuff. Cancer of the breast after ulceration has set in, epithelioma, and lung cancers. So all kinds of cancer, cancer of the breast, I knew that was there, lung cancers, and cancer of the epithelioma, which is the sheaths that cover the organs uh, of the body. It's good for influenza, hay fever, old nasal catarrhs, and catarrh of middle ear. So any kind of catarrh, thick mucus, middle ear, nose, any influenzas, swelling of tissue within the nose, hypertrophied, okay, utration tubes. Let's see, discharges cause burning. That's a big one. So that's why it says Arsenicum iodatum should be thought of when the discharges of mucous membranes are persistently acrid, which is burning, profuse, which is, flowing, or thick, gluey, yellow like honey in chronic disorders, and thin in acute conditions. So that's why you have the thin one. They acutely, they'll get a cold, they'll get whatever, they'll have the hay fever, they'll have thin mucus down the back of the throat, down the front of out of the nose. And then when it gets to be chronic, it becomes yellow and thick and honey colored. Let's see. In amenorrhea, which is no menses, the menses are not coming, with anemic palpitations and dyspnea, so heart problems and lung not getting the oxygen you need. Chronic pneumonia when abscesses is about to form. Great emaciation. Weakness, debility, heart weakened by chronic lung disorders. So anytime someone has those chronic lung disorders, it definitely eventually affects the heart. Arteriosclerosis, myocardial degeneration, and senile heart sensations of heaviness occurs in many parts. Axillary tumors, which I mentioned, they're better by open air, worse from dry, cold weather, windy, foggy weather, rooms. So it's worse from rooms, apples, and tobacco smoke. So they basically want out in open air. And that's how you would tell this one between some other ones, because uh, Kelly or Arsenicum iodatum wants to be out in the open air. There's other ones that they don't, when the allergies come in, was that yesterday's? I don't know, but anyways, they want to be indoors. So when you come to the allergy section in the repertory, which I showed you before you get into this part that has the repertory, before you get into looking at the medicines, you would look in uh, the repertory to find out which medicines would work. And then when you're doing that, you're differentiating, as I said yesterday, by choosing, oh, this person likes open air, the other person likes to be indoors. So that would help you to choose which medicine would be better for them. So that's why you're taking a case and you're getting all these symptoms and all these likes, dislikes, all these different situations that is going on with that person. And once you get all that, then you go to this repertory and you look in there and you see under whatever lungs, uh, whatever one is the main situation that they want to overcome. What is the main thing that would, if I relieved it, what would make you feel better? Oh, it'd be my lungs, or it'd be my throat. My throat's so sore, or it would be these night sweats. I can't, I just can't get no sleep. So if you were able to take care of the night sweats, say you gave Arsenicum iodatum, that could clear up all of them. Some of these medicines will hit every aspect of that when you match it right. But you're going for the throat, then you look under throat, and then you use some of these symptoms to determine which, so in other words, you go under throat, raw burning, You look down under, if it was a raw burning category, you'd go under there. And you can even narrow it down even further, by, is it better by swallowing, worse by swallowing, what happens? You could go for the stomach. I always throw up water when my stomach's always so upset, or my lungs. Oh man, I just can't get over this mucus and this burning and all this sensation. So whatever category you pick, it has to be the one that is the most debilitating to that person. And then you want a picture of that person, the whole picture, because when you go in and you start looking at medicines, now you got to differentiate between one medicine and another by what they like, dislike, what makes it better, what makes it worse, when did it start, what was the etiology, all kinds of things like that. So that is morning medicine. You can age, but you don't have to get old.